Good afternoon. I want to thank you all for joining us here today. I am accompanied by Kim Malzum-Risden, our Secretary of the Department of Health. I wanted to give you a quick update on how the testing is going down in Sioux Falls. We tested another 600 people yesterday. Combine that with the other tests that have been completed, we're up to about 3,200 samples that have been taken over the last 3 days. I really want to thank Avera and the CDC, the National Guard, and our Department of Health for working on this operation and putting forward a very successful day 3. And as I mentioned yesterday, our positive case numbers are going to go up, and they have. We expected that. Identifying more positives is a good thing. It's a good thing because we're identifying them before the plant gets up and running, and we're protecting these folks, keeping them isolated and healthy. We will continue to closely watch our hospitalization rates because that is incredibly important to see how our projections are going and we get through this current situation. My request to South Dakotans is to continue to be smart, to make good decisions, practice social distancing, wash your hands, don't be in large groups, and make sure if you're not feeling well to call your doctor. Today is also the National Day of Prayer. In America, definitely appreciates prayers for our families and people that are impacted during COVID-19 and the spread across this country. These times in so many ways are historic in the worst way. They impact our health, our economy, our mental health, and create lots of challenges. But here in the United States, we remain united. Right now, we're all united in the shared goal of fighting this virus. And we can look to the Lord for guidance, especially when times are difficult. So today on the National Day of Prayer, lift up our healthcare workers, those on the front lines, families who are struggling during this time, those that may be sick, but also those who've lost loved ones. That the Lord would comfort them and be with them. And also lift up all of our fellow Americans, that we see each other through God's eyes and give them grace. With that, I'll open it up to any questions that you might have.
Governor Reyes from Killen.
Yes, go ahead.
Yes, you mentioned yesterday that there may not be a need for a June special session, but possibly in September. Just curious what you've been seeing the last couple of weeks that makes you believe that there might not be a session needed in June. And I know September's kind of tied to the $1.25 billion flexibility. But what's been happening the past couple of weeks?
The reason that we don't know for sure when we will have a special legislative session or what it would look like or if one is necessary is because there is continued guidance coming out of Treasury from the federal government that tells us how we can utilize the dollars that have been appropriated by Congress. So as they give us more and more guidance on how those dollars can be spent, we're learning that we're getting a little bit more flexibility on how we can utilize the funds. And we're finding that we may be able to use some funds and replenish them with federal dollars later on. So that's some of the information we're still gathering, and then having conversation with legislators so we can make the best decision on when and if a special session is necessary.
Can I have a quick follow-up?
Sure.
So I know it's early, but have you seen anything encouraging in the last week? As far as any sales, any upticks, anything that's been encouraging in terms of revenue?
Well, as far as revenue goes, we have seen an impact to our sales tax numbers, and which I've currently talked about, and also a decline in other revenue sources for the state budget. What I think is encouraging is that we know our businesses never closed, that they had the ability to bring in some revenue. We'll have a clearer picture of what that looks like for our cities and for our state government here in about a month when we get the next full picture of what April did and happened in the state. So that's really hard for me to guess, although I think we're going to be in a better position than a lot of other states. There have been some preliminary reports that our job losses have not been as dramatically impacted as many other states, and that's good news for the families that live here.
Thank you.
Governor JP at News Radio.
Sure, go ahead, JP.
Thank you. 3,200 tests done so far. Are you continuing the mass testing today? And if you are, for how long?
Today, that operation is still running and taking tests from individuals that would like to go there. Today will be the last day, and then people will be directed to another site on Marion Road that is conducted by Avera. So we believe that we've seen the downward trend in people that are utilizing this site, and that the Avera facility and site will be able to be adequate. So I can let Kim give some more details on where that is at and what that testing site looks like.
Thanks. So as the governor indicated, the mass testing event will go through 8 p.m. tonight. And so we encourage all Smithfield employees and their dependents to take advantage of that and know their COVID status. After 8 p.m. tonight, then folks can access the Avera Clinic at 2100 South Marion Road. There will be folks available to test throughout the weekend. So we feel confident that that will continue to be a great resource for folks. And again, encourage people to get tested as that's available to them.
Thank you.
This is Morgan at the Rapid City Journal.
Sure, go ahead, Morgan.
I just wanted to follow up quick to the Kello question. Have the $1.25 billion been spent in any way so far, or you just kind of keep waiting for more guidance to come in on that?
The money that the federal government has sent to us that we have, and we're looking for guidance on how to appropriately spend that.
Okay. And then my other question today is, you mentioned tourism yesterday and the marketing efforts that they're doing, but is the message kind of that South Dakota is open to travel and open for business right now?
The message is that when people are ready to travel after the virus spread slows down, that South Dakota welcomes visitors, and that we'll be ready to ramp back up and be prepared to have people come here and bring their families and enjoy our outdoor spaces.
Thank you.
Governor, this is Stephen Groves from AP.
Sure, go ahead, Stephen.
I wonder if you could tell us a little bit more about the conversation that you have had with Treasury, and would that mean that the $1.25 billion would be allowed to be used for making up revenue shortfalls?
Well, they seem pretty firm in making sure that they don't want to bail out states for previous over-budgeting or overspending practices. They want to make sure that it can't be utilized for pension plans that are failing. And that's good news for us because we don't have either of those issues. But we have asked for flexibility to be accountable on dates that we could show the virus has impacted the state of South Dakota, prove revenue shortfalls based on prior performance, and they are very open to having that conversation. However, Treasury does feel that the language that was in the legislation that was passed is pretty restrictive. So there may need to be some statutory changes that come in another bill that would pass through Congress in order for that to happen.
And would that be impacting the $1.25 billion, or would that be another phase?
You know, it's hard to know because we've got quite a few governors in the country that are asking for more money beyond what has already been appropriated. My message to Treasury has been that I just need flexibility in the dollars that they've already given us. That if they will help us get some flexibility in how we utilize what's already been sent to South Dakota, that would be very helpful for South Dakota folks.
Josh, Dakota News Now.
Sure, go ahead, Josh.
You've noted that the number of hospitalizations has remained steady lately. It's been hovering around 70. Is there a number or specific range where the state would start getting concerned?
Well, we anticipate the middle of June that we could have up to 2,200 people in the hospital at one time on our peak date of hospitalization rates. So we know we are preparing far beyond that. We know that is what our projections say, but I committed to South Dakota that we would be prepared to take care of 5,000 people on our peak day. So today, I think that looking at our hospitalization rates, we're doing well. You know, we don't want anybody to be in the hospital, but we recognize that we're in a better position than I would have thought we would have been in several weeks ago. Several weeks ago, our projections were much more concerning, that we would have hundreds more people in the hospital at this point in time. So we're doing well, and I think the mitigation measures that the public has taken has been extremely helpful in making sure that our vulnerable populations are protected. The fact that they're staying home and those with pre-existing health conditions are taking care to be extra precautious has made all the difference in the world.
And that 2,200, is that COVID-19 cases or just all hospital beds?
Yeah, it would be 2,200 beds dedicated to individuals that would have COVID-19. So that we would have the capacity in the state of South Dakota to have 2,200 COVID-19 cases in the hospital on that date.
Thank you.
Yep, thank you, Josh. Further
Lori
questions?
from Keloland.
Yep, go ahead.
Yeah, I have a question related to the Smithfield testing. A number of employees were tested earlier, and is this a chance for the DOH to track maybe reinfection? Because there's some discussions in health circles about that. Can you track if a person tests positive several weeks ago and is testing positive again?
Right, that's a great question. This is Kim Alsam-Reisden. We do know that there is some uncertainty around the immunity that is built up after a person maybe experiences COVID. We are not testing folks that have previously tested positive, but to the extent that there would have been folks that tested negative in the past, they would be eligible for testing through the event that we're doing right now. I'm not certain if we're going to have the ability to track folks that might be positive now that were negative before. We're really just focusing on helping people know where they're at right now so that they can get back to work. But I appreciate that question. That's a good one.
Governor Adam St. Paul, Dakota Broadcasting here.
I think there was a CBS News, and then we'll go to South Dakota Broadcasting.
Hi, Governor. Thank you. Yes, this is Hannah from CBS News. I have a question for either you or the Secretary about the Smithfield mass testing event. Do you have any results from the first day of testing that you can share, or the other days?
We are starting to see the results come in from the mass testing event. We do not have the specific results from Minnehaha County separated out between the regular testing that's going on and the mass testing event. Those are reported at the county level, but we did provide the update today. We have 101 new cases of COVID-19 in Minnehaha County, as well as a total of 572 new negative tests statewide.
Governor Adam St. Paul, Dakota Broadcasting here. Had a question from a listener, was wondering, she looked through your guidelines or the administration's guidelines and whatnot and saw no recommendations for wearing a mask while out in public. She was curious as to why that is, basically.
Well, there's several recommendations on the covid.sd.gov website to follow CDC guidance. And CDC guidance today makes it an option for people to consider, doesn't make it a requirement, and we have consistently followed CDC guidance.
Thank you.
You bet. Further questions?
Governor, this is Stephen Gross from AP.
Stephen, go ahead.
I was wondering, do you wear a mask, and what do you recommend South Dakotans do as far as wearing a mask?
Well, I recommend that South Dakotans make the best decision that's for them and their families. I do have masks. I haven't been in public events where there's large amount of people to where it's been necessary. Was there another
question? From Keloland?
Yep, go ahead.
Yeah. Yesterday it was mentioned a little bit about nursing homes and testing of nursing home employees. And do you have any more information on that? Because that appears to be potential hotspots across the state when you look at other states. With the mass testing, yeah.
This is Kim Alsam-Reisden. So whenever we have a case associated with a nursing home, whether that's a resident or an employee, we immediately work with that nursing home to help them set up testing. Many of our nursing homes have very good relationships with hospitals already, so that's how a lot of the testing has happened already. But our state public health lab is also a resource to those nursing homes where they might not have that relationship with an existing lab. And so we work with them right away to identify what they need to do to be aggressively testing. In addition, there was some new CDC guidance that was just released this past weekend around testing when there are cases specific in the resident population of long-term care facilities. And so we'll be doing some additional work with the nursing home industry in the state to make sure that they understand that guidance and have the appropriate things in place to be able to follow that.
Would you expect that, around the state you would be, I don't want to use proactive, but that you would be at some nursing home sites that they would get more testing done before a COVID case is diagnosed?
Well, I think the key is when we're actually seeing COVID positive activity in these kinds of settings. We've talked before about just doing mass testing to see kind of where people are at, and that's not really an effective strategy because as we've talked, you could be COVID negative in the morning and be positive later that same day. And so really where the testing needs to be in these kinds of situations is at the first sign that there could be a problem, that we ensure that appropriate testing is happening and that we're isolating individuals and really trying to contain any potential outbreaks of COVID in those settings.
Thanks.
Chairman Kugelberg, Forum News Service.
Yes, go ahead.
Yeah, Governor, I just wonder if there's any update on the potential conversation between you and Smithfield employees.
Yes, we actually have a couple of calls here scheduled tonight and tomorrow morning with Smithfield employees, so I'm looking forward to the conversation.
Okay, thanks.
Any further?
Governor,
Sure, go ahead.
This is Stephen Gross from AP. With the calls that are scheduled, I was wondering if you could tell us who organized it with that. I've heard from the organizations that sent you that letter that they haven't heard from your office. Was that with the union, or how did that call get organized?
Yeah, the letter specifically asked that I meet with Smithfield employees. So we worked with HR at Smithfield and reached out to them, got all of the employees' telephone numbers, and then have lined up a call that will facilitate interpreters so that we can have questions and answers and get them all the information that they may be wanting. Okay, thanks so much. Have a good day.